Hello and welcome for joining us. You have joined us in Module 1 of this three-part series looking at the menopause. This masterclass is going to focus initially on understanding a little bit more about your body and how the hormones affect it and how it changes as we go through different stages in our life. Module 2 is going to really focus on weight management, why our weight is more difficult to control as we go through the menopause and in later life, and what we can do in order to sort of adapt our habits in order to manage that. And then Module 3 is going to look more at some of the side effects and how the research suggests that we can make some diet and lifestyle changes in order to minimize some of those side effects. I really hope you find some useful take-home messages from this series and something which can help to adjust the impact of the menopause on your life. So why do we transition into the menopause? So the premenopausal body is adapted to be more efficient for childbearing. So we go through this phase from puberty until the menopause, where every month our body is preparing in order to carry a child. So the lining of our womb thickens, and then when we don't fall pregnant, we have our period each month. As we get a little bit older, the menopause starts when there's a natural decline in the reproductive hormones. And when we're talking about reproductive hormones, we're going to be focusing mostly around estrogen levels. Estrogen is a hormone which is produced primarily in our ovaries. Also, our fat tissue does naturally produce some estrogen, as well as our adrenal glands. Our adrenal glands have an impact with our fight and flight response and anxiety. So we do find that your estrogen levels can also sort of increase and reduce depending on stress levels within your life. So we find that stress management can also help to sort of stabilize our hormone levels as well. You may have heard the term perimenopause, and this is the stage when hormones are starting to reduce. Your periods may become irregular, but have not yet completely ceased. And then we use the term menopause as a definition for it being at least 12 months since your last menstruation. The average age to reach menopause is 51, and perimenopause usually starts in the 40s. Although people can be varying ages, there's really no right and wrong, and certain health conditions can influence the age at which you start this menopausal process. So the hormone estrogen really does have a big impact on our body. Not only does it affect the way our reproductive tract works, but also our urinary tract. So there can be an increased risk of urinary tract infections as our hormones change. It affects our heart and blood vessels, our bones, our breasts, our skin, our hair, and also our brain. Before we reach the menopause, women really do have an advantage by having an increased level of estrogen because it does have quite a protective effect. It helps to make our body more sensitive to insulin. It prevents our body putting fat around our middle, which is the sort of riskier fat from a cardiovascular disease risk. It tends to keep our cholesterol a little bit lower and helps our bones to become stronger. So I like to think of it that we're advantaged pre-menopause, and we're sort of just leveling out when we get to the menopausal stage. And with us living longer, I was watching the news the other day, there was a lady who'd lived to 120. So really we can live sort of half of our lifetimes post-menopausal. So it's really important that we look at our lifestyle habits that we've built up through our lives and start to make some adaptations at this stage in order to better manage those symptoms and look after ourselves for the future. So because estrogen has an effect on so many different elements of our body, we do find there's quite a big range of symptoms. Some people will be more affected than others. You may find that some symptoms are more severe and others you don't notice at all. It really is quite an individual process. Various studies have shown that people who are healthier tend to have less symptoms. If we can manage our mental health and keep active, certain dietary changes, we can minimize the impact these symptoms can have on our day-to-day life. It is really important, though, that if you are finding that symptoms are affecting your health, your relationships, your ability to maintain work, that you do speak out. Seek some help, chat to your GP, and we'll talk about some of the medications in the next slide as well. So some of the common symptoms: changes to your periods. You may find they're less easy to predict than before. You may find that some months are very heavy, may become anemic as a result of this, and that can influence tiredness. So this could be a really key point in order to reach out if your periods have become particularly heavy, or you're passing clots each month. Really important to seek some help at this stage. Hot flushes and night sweats can be particularly disturbing for some people. If your night sleep is interrupted, then that can also affect your mood as well in the daytime. And a hot flush is the sudden feeling, sort of overwhelming feeling of feeling hot and agitated, needing to move to a different place to cool down. Normally doesn't last too long, but really people do get a different individual response to this. Estrogen helps with lubrication within many parts of our body. So we do find with a reduction in the amount of estrogen, we can experience drier skin, vaginal dryness, and also less lubrication within our joints as well. You may also find that there's changes to your sex drive. This is really natural, but if you find if it's influencing and impacting your relationship negatively, then again, please do speak out and seek some support for this. Sleep disturbances, change of mood, memory and concentration can all sort of go hand in hand, and we'll have a look at some of the ways we can manage our sleep routine. And then also joint pains as well. Often people will find that maintaining their activity and being active every day can help to lubricate your joints and reduce these symptoms. You may also find that you want to look at the sort of impact of your exercise and go for some slightly less sort of lower impact exercises. So do have a chat to your exercise team and ask for some support. You may just find you need to sort of change things up a little bit. So do speak to your doctor about the risks, the benefits, different suitable treatments and dosages for you if you're finding that your side effects from menopause are not really manageable just with lifestyle and diet. The series of modules isn't really the best place to discuss individual medical treatments. Really important that you speak to a qualified pharmacist, GP, or a specialist if you need some extra support in this area. A lot of the medical treatments, we think of hormone replacement therapy, or HRT, with the main goal to replace some of the estrogen and certainly stabilize our estrogen levels as we go through this adaptive change. There's lots of different types of treatments available and different types of forms. You may come across patches or gels, sprays, implants, or different oral medication and tablets. Interestingly, when we take a medication, our liver works to detoxify this medication and break it down. But with the estrogens, we need them to maintain in the body. And this is why the patches and the gels and sprays are particularly good, because it helps to bypass the stage in the liver and maintains a higher level of estrogen within the body. So it can be easier to get onto the right dose, and we need a little bit less to be effective. You may also be prescribed a combined hormone replacement, which contains some progesterone as well. And the progesterone can help to protect your womb lining and reduce the risk of uterine cancer. Some people are prescribed testosterone. Various reasons for this, and something that your medical team will discuss with you directly if it's appropriate, as well as different non-hormone medications to manage each individual side effect. If you feel that your mental health is being affected, it may be that you need some treatment with an anti-anxiety or antidepressant. You may also find that night sweats and hot flushes are getting particularly bad, that you need a little bit of treatment there. There are a couple of medications available. So do reach out for some help. If you do go to a doctor's appointment, I find it so useful to write a list of sort of experiences, symptoms, and then questions. These appointments can be quite rushed. So have that list with you towards the end of the appointment, have it in front of you, and just run through and make sure you've covered everything that you wanted to talk about. As we said, less estrogen, it can cause a bit of brain fog, memory loss, and reduced concentration. So keeping lists and writing things down can be really, really helpful. Self-care with lifestyle modifications. Some of these things we're going to cover a little bit more in Module 2 and 3, but it's important to review your dietary habits and your daily lifestyle. So from puberty until now, we've built different habits that have worked for us, worked for our busy lifestyle, but also worked for our body with a higher estrogen level, where maybe we've had a little bit more energy, we've been a little bit more on the ball, and now our estrogen levels are declining. We may just need to review those habits and make a few changes ready for our new bodies. So helpful to talk to others who are experiencing similar symptoms or have already gone through those symptoms and through the menopause. The period of perimenopause, so as our body transitions, can on average take around 8 years. So it's something that doesn't happen overnight. We go through changes. You may find that those symptoms go up and down. Establishing a good sleep routine and having enough sleep and helping yourself to get to sleep in the evening can really have a big benefit. Making sure your body is well rested is going to help you to cope better with those other side effects. Take time for relaxation and exercise regularly as well. So I wish you all the best until we meet again on modules 2 and 3. I hope you have had a little bit more understanding about why we go through the menopause and how this hormone estrogen has such a big impact on our bodies. As I said, it is a natural process, but just because it's natural doesn't mean that we really do get very real symptoms and side effects. And there is help and support out there. So do reach out for some help and support if you need it. In the next 2 modules, just to give you a little heads up, we're going to have a look at some more dietary goals. We're going to have a look at body composition, how the changes can affect our muscle mass and our abdominal fat distribution, how to maintain bone density, different dietary managements for hot flushes, and some managements for dryness as well. I'll chat to you again soon.